It's May 25th, 2019, and this is a video about the University of Utah and about how you should not trust them with your health. My wife and I, we had 3 children at the University of Utah Hospital. Over the course of our time there, we met several midwives, many of whom were kind, but the first issues we ran into with the University of Utah were issues revolving around translation services. So the first incident of note is when a lady in the hospital translation department was rude to me over the phone. I complained about her, and a manager in their customer service department threatened to boot my family in response. So that was the first thing. Second thing was, my family was going to we were seeing a midwife at the South Main Clinic for the University of Utah, also a Salt Lake County facility. And when we transferred our care there, we received a written letter from a nurse manager in the College of Nursing stating that our translation preferences would be honored, and our preferences were always for in-person interpretation. In-person is better than over the phone in all cases, unless the in-person person is inept, but usually they're not. So we complained about that, and the response, the university initially provided in-person interpretation, and then they changed their mind, and the manager, the University of Utah manager over the South Main Clinic, told me that they didn't have to provide equal levels of service with regard to interpretation at that location. And so they basically broke their promise. I have a written letter from a college nursing manager saying they would honor our interpretation preferences. Then they reneged on that promise, and a manager over the South Main Clinic basically said, no, we're not going to honor your translation preferences anymore. We'll just do over the phone. So we complained about that issue to the lawyers on President's Circle, the Equal Opportunity Office. Now, that complaint took about a year for them to process, and they sent a very detailed response, basically denying everything and ignoring everything, and ignoring the fact that they were reneging on their promise, and so on. So there's that. Now, next thing that happened was my wife went to see an OBGYN. I think her name was Egelbrotten, something like that. Egelbrotten. And for that visit, we were supposed to have an in-person interpreter. So this high-flying OBGYN lady came in to the room, and she demanded to use my personal cell phone for the interpretation. She also she used my cell phone. I told the staff before she came in that we wanted to wait, not use it over the phone, but this lady came in, she demanded to use my personal cell phone. She called the interpretation service. She turned up the volume really too loud, and then 5 minutes later, our in-person interpreter showed up. So I complained about her via email. I used the University of Utah email directory, and I complained to the manager who's over the OBGYN doctors. Now, about 2 or 3 days later, I received a letter from Jessica Howsden in hospital customer service. The letter from Howsden didn't address any specific complaint I'd made. It was just a generalized threat. Like, watch out what you say, or we're gonna boot you. That was the basic tone of the message. Okay, you can use flowery, highfalutin language to basically convey that we're gonna crap can you if you don't shut the F up. That's what the real message is. So you can read the email, the letter if you want, but that was the clearly understood message. Plus, the letter didn't address any of my specific concerns. that I sent in the original emails to the people. And also it was a basic de facto retaliation for the fact that I was expressing my First Amendment right to contact the government about grievances, redress of grievances. Now, the University of Utah has a publicly searchable employee email directory. But if you're a patient of the hospital and you use that email directory as part of your First Amendment rights to complain about poor treatment or rude doctors, the hospital customer service department will send you a letter of threat in response. So that's the first time that thing happened, when I complained about the OBGYN inappropriate actions of Egelbraten woman, OBGYN doctor at the University of Utah, when she demanded to use my personal cell phone for interpretation instead of follow my express preferences, our express preferences, to have an in-person interpreter, and to maybe wait 5 minutes for the person to show up, which they did. But anyway, so next, I filed a complaint about the letter I received from Jessica Howsden to the lawyers on President's Circle in the Equal Opportunity Office. I also complained to the U.S. Department of Health and Human Services. Now, once again, the lawyers on President's Circle sat on my complaint for about a year. And they also tried to dismiss it a few times, which I then had to appeal. So they dismiss it, I appeal, I dismiss it, I appeal. Then eventually they just sat on it for a year, and then they dismissed it. Okay. So, next thing that happened. Next thing that happened was, so my wife had 3 kids at the University Hospital. She got pregnant with our 4th child. Now, we liked the midwives in general, but this was the beginning of a downturn with regard to our experiences with the midwives. We went to see a midwife whose name is, I think it's Emily Du Bois Hollander, at the South Jordan Clinic of the University of Utah, near the Daybreak community neighborhood. So my wife showed up tired from morning sickness to her first OB visit with Du Bois Hollander. And Du Bois Hollander noticed that, and she said, well, how are you feeling about this pregnancy? If you don't, and I'm paraphrasing, but it's pretty good, accurate paraphrase, if you don't feel like you want to continue the pregnancy, then, well, there's options. There's options for not continuing the pregnancy. And I was sitting in the room thinking to myself, what the fuck? What the fuck? You're just offering to kill my baby because my wife showed up pregnant to this visit? So I kept my mouth shut during the visit. I was a little bit, I was annoyed at the visit, during the visit, but I didn't really say anything. So guess what I did next? I used the publicly available phone directory for the University of Utah to search for the managers and the midwife herself, and I complained about the fact the university was pushing abortion onto my wife, pushing baby killing, also called, I think babies get killed in abortions, baby killing onto my wife. Then about 2 days later, in the electronic chart for my wife, and also via paper mail, regular mail, we got a letter from Jessica Howsden, customer service. That letter didn't address any of the specific concerns I had. Nothing. But one thing it did do is it did a few things. It said, watch out what you say on social media. We might have a chaperone come to your visits on a mandatory basis. So if you show up to one of our clinics, we might require you to have a chaperone in the room with you at the same time. They didn't address she didn't mention the word abortion in the thing, but I mentioned abortion in my emails. Okay? Having a woman show up to her first OB visit, tired from morning sickness, and then the midwife does basically a psychological eval on the woman and decides, well, this woman isn't really super excited on her first OB visit, or she's a little tired, so I'm going to tell her about how she could just kill her baby. I mean, do you think about it? Is that the purpose of a midwife? Are midwives supposed to do that? What do you think? Are midwives supposed to do that? Are they supposed to offer to kill babies? Are midwives supposed to bring life into the world or kill life, destroy life? Which? Which is it? Which is it? So I complained about the letter from Jessica Howsden about how it was seeking to quash my First Amendment rights to have a redress of grievances, about how it was retaliation for a complaint, about how it didn't address any of my concerns. I complained about that to the Equal Opportunity Office of the University of Utah, the lawyers on President's Circle. And you know what happened? They sat on it. They sat on my complaint for a year, and then they dismissed it. Okay? They sat on my complaint for a year, and then they dismissed it. So, that happened. Those things happened. Now, another thing that happened was the University of Utah has blocked my ability to complain on their Facebook page for the hospital. They haven't blocked me for the main university, so I guess I've got that out there. But the hospital has blocked my ability to comment on Facebook. Now, does that violate the First Amendment? The University of Utah is a part of the state of Utah. And the state of Utah is a state of the United States. An arm of the government has blocked my ability to comment on their publicly viewable Facebook page. Does that violate the First Amendment? Yes. It does. Why? Well, if President Trump can't block his detractors on Twitter by court order, then an entity of the government shouldn't be able to block me from being able to comment on them and to them on their publicly viewable Facebook page, but they are. The lawyers on President's Circle utterly ignored that issue also. So what we have here with the University of Utah is entrenched bureaucrats who haven't read the Constitution, who don't know what their duties are with regard to civil service, and who put patient safety at risk because they retaliate against patients who complain about poor treatment. Okay? That's why socialized medicine is maybe a problem, would be a problem, and is a problem, because you have entrenched bureaucrats who just want to cover their own asses and who are not interested in patient safety, who are not interested in good patient care. They're interested in covering their asses, period. An entrenched bureaucracy who behind closed doors decides against you. They'll decide to shit can you if you cross the line, and the line is complaining about them in a way that they don't like. Okay? The University of Utah will put your health at risk if you encounter a provider or a situation that's negative and you complain about it. They will threaten to boot you, and you have zero recourse with the Equal Opportunity Office at the University of Utah. Zero recourse. So that's the situation. Okay? So we had our fourth kid at a different hospital, and I basically told my doctor and all of our doctors that I can't go there. We're not going there under this hostile environment. We're not going back. Hostile environment. Patient threatening environment. The customer service department of the hospital is a patient threat department. The Equal Opportunity Office at the University of Utah is a University of Utah protection racket. Okay? So, that's the situation. Little old Utah, who would have thought? a bunch of socialist Marxists would be running a public university and operating it like it's their own little private club for making as much money for them as possible. Money and power. That's all. Not patient safety. Not honoring your promises. Not following the law. Not following the Constitution. None of that. Just a money-making protection racket to make power and money for you. And that's it. So welcome to socialism. All right. So I used to be an advocate for single payer, but no, not anymore. The University of Utah has taught me that public people, entrenched bureaucrats, will try to shit-can you if you complain about their racket. And that's what the University of Utah is. A racket. A bad one, too. All right. That's my message for today.